We have developed and invented actually a new approach to information technology. Without getting too technical, other software focuses on the data, how to store the data in some kind of a database, and then how to query or write questions to the database to hopefully get answers to things that you are interested in. The problem with that approach is you don't know what all the questions are that could be asked, or all the answers that the database may hold that would be valuable to you. So what SpeedTrack has done is we literally, instead of storing the data, we store all the information in the data. And then through a patented interface, we allow you to explore all the questions you can ask and all the answers that you can derive from the underlying data by navigating through them. So you can iterate very quickly and see what other questions can be asked. And they literally lead you to answers. So rather than having to guess what question to ask to get the answer you're looking for, you can be guided to the various answers that are available, and you can pick the best one depending upon what you're interested in looking for. So that's the key difference with SpeedTrack and other traditional software. As Linda said, we've created an application specifically for hospitals. We are hosting every patient encounter for every hospital in the state of California. It's currently about 90 million patient encounters, and it's for the last 5 years of data. And we get that data from a state department called HCI, and I can't remember what the acronym stands for, but essentially what they do is they collect data from all the licensed healthcare organizations within the state, whether they're acute care hospitals or clinics or what have you, and they maintain that data and make it available back to the healthcare professionals to analyze for their various reasons, whether it's healthcare operations or strategic planning, marketing, that kind of stuff. So that's what I'm going to show you here today. And as Linda indicated, we've actually fabricated data. So it's not real data for HIPAA reasons, but it has everything the production platform has. Frankly, you can't tell the difference from a usability perspective. And we've actually used the real names of hospitals throughout the state, since the names are publicly available, but all the patient information is completely fabricated. So are there any questions before I get started with the SpeedTrack application? And by the way, once I get started, please feel free to interrupt as I go through it. Obviously, this is for your benefit. So let me see here. I'll probably have to reshare, but this is for your benefit. As I was indicating, please don't hesitate to interrupt at any time. And I'll try to answer the questions to the best of my ability. Are there any questions before I get started? Awesome. Well, I'm just going to go ahead and jump right in and give you an overview of the application, and then I'll go through a couple of use cases, and I will probably ask for some interaction with the class, participation from some of the class members. It makes it more fun that way. And like I said, feel free to stop me. So what I'm going to do is I'm going to bring up the application. It's this little hexagon down here. It shouldn't be too done, but anyway, here's what it looks like. And I know it can be a little bit overwhelming at first, but let me walk through it, and you'll pick up on it pretty quickly. It's actually very intuitive once you understand.
Hey, Jeff, I hate to interrupt, but you have a question in the chat.
Okay.
Eric is asking, he said that he sees it's been around since 2004, and he wants to know if there's been a big change with data usage since then.
Absolutely. And yeah, the company's been around that long. This application has not been around that long. We have applications in not only healthcare, we have several applications in healthcare, but we also have applications in the automotive industry, as well as the law enforcement industry. And we're expanding beyond that, but our principal focus today is healthcare.
Thank you.
Yeah, you're welcome. And please feel free to use the chat. And Linda, if you could monitor that for me, that would be great. And just interrupt me as people ask questions, etc.
Happy to do it.
Cool. So as I was talking about, This is what the interface for this application looks like. As you can probably recognize, this is a list of hospitals. You can see there's 499 hospitals out of 499 listed in this list. And we call each one of these boxes or lists a category. So within this list, you can see it's sorted in descending order of frequency. And what these numbers in the right
Jeff,
hand.
I'm sorry, we're not seeing anything but the homepage.
Oh my gosh. Yeah, I have this problem every time we do this with Zoom, and I don't know why. It's just with the Zoom with Cal State Long Beach. I use Zoom all the time. Okay, let me try this. It doesn't seem to switch when let me try something here. No, that's not going to work. All right, I'll just have to switch back and forth as I do things between different applications. Let me know if you can see this now.
Yes.
All right. Thanks for reminding me. At least they didn't go on for 20 minutes.
One of the students popped in and said, and Alejandra said she can only see it. I guess she was afraid she was the only one that could only see it. And immediately I thought she's right.
So here we go. Let me start here. So you can see that there's 3 separate data sets. There's the ambulatory surgery data set with about 10.5 million patient encounters. There's the ER data set with over 59 million patient encounters. And then there's the inpatient data set with almost 19 million patient encounters, over 18.5 million. And if you add these 3 numbers together, you get the total down here in the left-hand corner, which is over 88 million patient encounters on the platform. And so the way we segment these 88 million patient encounters is within each of these categories. You can see, for example, in this case, as I was mentioning, there's a list of 499 facilities, and we split up those 88 million encounters across each facility, and it's sorted in descending order of frequency. So you can see the facility with the greatest number of patient encounters across all 3 data sets at the top of the list, and that's Kaiser Foundation Hospital of Fontana. And then likewise in these other categories, for example, patient, city, and community, you can see which cities and communities have had the greatest number of patient encounters, and they're always sorted in descending order of frequency. Likewise with zip codes, counties, and then down here on the bottom in the second row is the type of insurance the folks have. And for emergency room and ambulatory surgery data, we get actually a different feed of the insurance categories than we do with the inpatient data. That's why there's different categories between the two. But you can see how they're listed here in descending order of frequency. For the inpatient encounters, we show them as a visualization like bar charts or pie charts. The first one is the principal payer category like Medicare, Medi-Cal, private coverage, et cetera. And then this category over here, it shows like managed care, other types of or traditional coverage, which is fee for service, et cetera. And if it's managed care, it will show you who the payer plan is with for those managed care contracts. And then in these different tabs, we have different categories. So for example, in the patient dashboard tab, you can see the sex, race, ethnicity, age ranges of the patients. I'm not going to get into the second row right now. And then in the MSDRG tab, for those of you that aren't familiar with MSDRGs, they're a way that Medicare actually came up with for identifying the charges for various procedures and diagnoses for the patients. And you can see that there's 796 different MSDRG codes. Here's the 789 actually over here. And next to them is actually the description of each MSDRG. We roll them up into their families, and then down here, we roll all the DRGs up into various service lines. So there's 16 service lines: obstetrics, general medicine, et cetera, and subservice line, infection, joint replacement, et cetera. And then we have diagnoses, procedures, et cetera. I'm not going to get into those details right now. But are there any questions with what I've done so far? Okay, what makes SpeedTrack unique is, as I indicated when I gave the description, is rather than storing data, we store the information. So other programs, if you're familiar with using databases, You have to ask it a specific question. And if there's an answer to that question in the database, it'll give you the answer, nothing more, nothing less.
Jeff, excuse me, we have a question.
Yeah.
What does MSDRG mean?
Okay. Do you happen to know? I can't remember.
Do I know? No.
I think it's Medicare diagnosis. No, I'll get back to you on that. Frankly, I can't remember exactly what it means.
You know what? I'll look it up on the other computer while you're talking.
That
Oh, here
would
we
be
got it.
great.
Eric's telling you. Eric says it's Medicare, severity, diagnosis, related groups.
That's okay. Thank you. I should memorize that.
Pretty hard to memorize.
Severity,
Thanks, Eric.
diagnosis, related groups. And so again, what they indicate is the level of charges that hospitals can charge for these various diagnoses and procedures. So the way they're designated is they're called groupers. It's a grouper algorithm, and what the algorithm does, it's a software algorithm. It goes through and assesses the procedures and or diagnoses associated with each patient stay, and then it comes up with a category. And some categories, like I'm going to click on septicemia here for a second, and you can see there's actually two different categories or MSDRGs associated with septicemia. It either has with major complications and comorbidities or without major complications and comorbidities. And there's several types of MSDRGs that are segmented that way, because obviously if you have major complications and comorbidities, you're more likely to spend more time in the hospital and have higher costs or charges than a patient with the same disease diagnoses that do not have major complications and comorbidities. So as you may have noticed, when I clicked on septicemia and severe sepsis, the entire shape of the other underlying information space changed. And it doesn't matter what I click on. And the reason that's important, and I can click on anything, it doesn't matter the order I click on them. So for example, if I want to look at Oakland, California, in terms of the patient, city, and community, I see that has 1,107,000 patient encounters. As soon as I click on Oakland, everything changed. It's reflecting back only the information associated with patients that live in Oakland. Here's those zip codes associated with Oakland. I can see it's in Alameda County. I can see here the facilities or the hospitals that those patients went to. Highland Hospital is number 1, followed by Kaiser Oakland, Alta Bates Summit Medical Center in Oakland, et cetera. And the reason this is important is it's literally guiding me through the information. So if I want to see what the number 1 hospital is that patients in Oakland went to, right off the bat, I can see it's Highland. And then when I click on Highland, I can see where the zip codes are that they came from, the type of insurance they had, principally Medi-Cal, and everything else. If I click on every tab is changed to reflect only the information associated with Highland Hospital. So it's very easy to build complex queries and be guided through millions of records, literally within a couple seconds. So that's the number 1 thing that makes SpeedTrack different. Are there any questions based on how the underlying technology works before I get deeper into some use cases? Cool. So the first thing I'm going to do is walk through a use case that we built for CSULB classes. And it's really built for understanding the market. So if you guys are doing marketing, this can be a very valuable use case. So I'm just going to click on Start Over to clear the query I started building. By the way, I should have pointed out that up here at the top, we have what we call the query box, and it shows what I just did. I clicked on, Oakland City and Highland Hospital. Now, when I click Start Over, I'm going to start over. That's going to be all cleared. I'm going to start at the beginning. And so let me just bring up, tell me if you can see this. I'm going to bring up the this use case and show it to you. What we're going to do is we're going to walk through a use case where we're going to start with identifying a hospital. And then we're going to identify the principal service area for that hospital. And then we're going to apply that service area and do an analysis of a history, a trend associated with every service line for that hospital over the last 5 years. And so you can see what the trends are, and we'll be able to filter those trends by things like the type of insurance they have, the service line they used, the race, ethnicity of those patients, et cetera. And we'll also be able to do a geospatial map. First of all, can you see what I'm showing you?
Yes, we can see it.
All right, cool. So let me go back and we'll walk through what I was just talking about. Before we do that, I'm going to open a new Excel spreadsheet because we're going to be using that when I walk through this. Here we go. When I walk through this use case, can you see the Excel spreadsheet?
No, I think we only see what you, what you were showing us with the red lines across the little boxes and stuff.
All right. All right. I'll have to do it. I don't know why the CSULB Zoom does this. I don't have this problem with.
Because it's irritating. It does me the same way. I have to open it.
Yeah.
It thrives to irritate people, because it happens to me when I'm trying to share screen all the time. I can't find the share screen. It's out there, but I can't find what to click on,
Yeah, I can find the share screen. It's just that you have to click on each application in the share screen to share it rather than just click on the monitor that you're sharing.
Right. It doesn't follow your what you're doing.
It must be a restriction that you guys have.
Well, I can assure you it wasn't built because of me, but then they didn't ask my opinion about changing the canvas either. And so I don't think my opinion really matters much.
Well, let's go ahead and walk through this use case. And so the first thing we want to do is pick a hospital. Does anybody have a hospital, in particular hospital, that they would like to do this case study on? All right.
Come on, Eric. I know you have one. Oh, here we go. Cedars-Sinai from Alejandra.
Okay, everybody picks Cedars-Sinai for some reason. So what I'm going to do, I can see it here on the list, so I could just click on it. But if I didn't see it, I can also just search for it. And there's Cedars-Sinai at the top. I'll just click enter. Just click on it, I guess. There's Cedars-Sinai. So I've selected Cedars-Sinai. And for this analysis, I want to focus on inpatient encounters. So I'm going to click on inpatient encounters. And so I'm going to be doing kind of a strategic planning / marketing assessment of Cedars-Sinai. So in order to get started, whenever you're doing strategic planning or marketing assessments, you typically do not include the normal newborns. And the reason for that is normal newborns don't use much utilization in the hospital. They kind of show up and leave. As long as it's a quote unquote normal newborn. Now, if it's a newborn that has some kind of issues, other diagnoses associated with that newborn, then they will stay. But the way we remove them is normal newborn is actually a DRG. So I'll click on the DRG dashboard. And you can see it's number 1 here, and that's typical because there's usually a lot of obstetrics in hospitals. And the way I remove it is I just right-click on it and click on negate. And so that removed it. So I'm looking at everything except normal newborns. And you can see up here in the query box that now it says not normal newborns. Now what I'll do, so we've isolated inpatients for Cedars-Sinai hospitals, removing normal newborns. Now I'm going to focus on the most recent year. And the reason I'm going to do that is so I can isolate the most recent year of zip codes in terms of descending order of frequency for those zip codes. So I'm just going to click on 2021. And let's say that these top zip codes here, just for simplicity, well, let's make it a little bigger than that. Let's say down to here, 90018. Makes up the majority or the service area for Cedars-Sinai. So all I have to do is hold down my shift key, click on the first one in that range, go down to the last one, click on it again, and then release my shift key. And I've I've isolated those zip codes. Now notice that homeless really is not a zip code. So what I'm going to do is I'm going to right click, copy these zip codes. Then I'm going to go to my Excel spreadsheet and I'm going to have to change the window that I'm sharing to show you that. Hang on. That's it there, I believe. Can you guys see the Excel spreadsheet?
Yes.
We can, yes.
Okay, then I'm just going to paste it right here in the spreadsheet, right click and paste. And there's those zip codes that I created, along with the number of encounters from each zip code and the percentage of encounters for each zip code. The first thing I'm going to do is, because homeless is not a zip code, I'm just going to remove homeless, because it'll distort my analysis if I include homeless in there, because homeless are not identified within that service area, which is defined by the zip codes. We don't know where they live. So I'm just going to delete, in this case, the homeless, nothing personal there. And then I'm going to turn these into percentages just by clicking on them and turn on percentage. And then what I'm going to do is I'm going to total the percentage here. So I'm just going to go equals this cell, 14%. And then in the next one, I'm going to go equal the top cell plus the cell next to it. Did that work? No. Let me try that again. Sometimes I fat finger this stuff. So I'm going to go equals, oops, I hit plus, that's the problem, equals this one plus that one. So this is going to be a sum of the top two. So 14% plus 10% equals 24. And then I'm just going to copy this down. So what this is showing me, oops, copy this one down, is the cumulative percentage of these zip codes as I go down. And so I can see that right here, we reach 75%. And so what I'm going to do is I'm just going to copy these top zip codes down to 75%. And I'm going to call that the primary service area. So now I'm going to clear this. And I'm going to apply those top zip codes that I just identified with a Control V. I pasted them in there, and there they are. There's those top zip codes. And so that's the primary service area.
Jeff, we're just seeing the same sheet.
Oh, yeah, got it. So let me do that again. I'll go back to the application and let me know when you can see it.
We can see the application now.
Okay. So what I did was I took the zip codes from the spreadsheet down to 75%. I copied them, and then I came over to the application right here, and I pasted them right here in the patient zip code. So I just did a Control V to paste them. It ran that query. So what I've done is I've identified Cedars-Sinai's primary service area. And now I'm just going to unclick Cedars-Sinai, or click the trash can up here. And what that's going to do is that's going to show me all the hospitals that patients from these zip codes have gone to or went to in 2021. Now I'm going to uncheck 2021, and it's going to show me where these patients have gone from this primary service area over the last 5 years. So that's what I wanted. I can see it's 135,000 patient encounters over this 5-year period. And you can see that 42% of the patients in these 8 zip codes went to, actually almost 43%, went to Cedars-Sinai over that period of time. So the first thing I'm going to do is I'm going to export this data into a template that we've created. So I come down to, and by the way, this is all spelled out in this use case that I created. So if you guys ever want to do this, you can just refer to this, and it's step by step over everything I just did. So you don't have to memorize this stuff. This is all available through the curriculum at CSULB. So I'm going to come down here to report template. It's going to open up this other application. This template I want is the inpatient trend macro. So we have one for ambulatory surgery, one for emergency room, but in this case, this is inpatient. You can see I got the inpatient box clicked up here. So I'm going to export this data to the inpatient macro. Just click on export to a spreadsheet. It asks me if I want to save it. Click yes. And now what it's doing is it's hitting our server in the cloud, and it's going to download all these 135,000 patient encounters over this 5-year period of time. So that'll take a few seconds. While I'm waiting for that, are there any, let me see, additional questions that need to be addressed? Here we go.
I don't see any in the chat.
Okay, I think we're good. Last one was Cedars-Sinai. Probably should have done just 3 years. It would have been faster, but this isn't bad. It should be fairly quick. There it goes. It's downloading those 135,000 records. Now, all I do is click on the inpatient trend icon here, or link. It opened those up into a spreadsheet, Excel spreadsheet. I'm going to click on that spreadsheet. And now what I'm going to do is I'm going to go back to share my screen for that new Excel spreadsheet. All right. So here's those 135,000 records in the spreadsheet. It's each patient encounter. It's going to show the facility it went to, the year those patients were discharged, their age range, sex, race, ethnicity, the service line, subservice line, the type of insurance they had, the payer type, which is whether it was managed care, and what kind of payer plan for managed care plans. So what I'm going to do now is you can see there's a speed track icon, and all of you guys have access to this through the portal at CSULB. But you can see we've added a speed track menu bar or menu tab, whatever they call it up here. I'm going to click on that. And here's this icon for a market share analysis. I'm just going to click on that, and it's going to run all these 135,000 patient encounters through the macro and create a series of reports that should come up in just a second here, and we'll walk through that. And you'll probably, hopefully you'll see why this could be valuable for marketing and strategic planning. Okay, so here's those reports. As I scroll down, well, first of all, you can see up here is the fields that are available that I just went through a moment ago. And as I scroll down, the first report is a market share pie chart. It shows, as we saw before, Cedars-Sinai has 44.4% of the market share for the 2021 data, which is the most recent year in this application. And you can see the rest of the hospitals in their color in terms of market share for 2021, and then all others. So it shows the top 10 and then all others combined. This next report shows the actual trend by case volume and for the last 5 years. So you can see that Cedars-Sinai actually dropped in total volume during this period of time. And if I scroll down a little bit, you can see that the orange there is 2020. And that's typical because a major—
We're not seeing any colors, Jeff.
You're not? Can you see the reports?
All we see is the Excel worksheet.
All right. This is crazy, but I'll be patient. All right, here we go. So this is the output of that macro I clicked on. And so as I indicated, here's the fields that are represented up here, and I'll get into greater detail in this in a moment. But the first report is the market share pie chart for 2021. And Cedars-Sinai, as you can see, had the greatest slice of the pie at almost 44%. And you can see the other top 10 hospitals listed here and their percentage of the pie. And then as I go down, the next report is the trend by case volume for this 5-year period. And I assume you can see the colors of the bars now.
Yes, we can.
So as I scroll down, you can see Cedars-Sinai had the greatest amount of volume for this 5-year period. And as I scroll over them, that's 2021, 2020. And what I was getting at is there was quite a dip in 2020. And that was because of COVID. And so there was a big dip in 2020. It started to recover in 2021. I expect, in fact, that we've already seen the trend for 2022. We haven't updated this application yet with the latest data, but we probably will be in the next month or so. And the trend for other hospitals that had cases from that zip code, and you can see that Cedars-Sinai commands that area defined by those zip codes. They get obviously the majority of the volume, although quite a bit of volume has been going outside Cedars-Sinai to below the top 10 hospitals outside. So that's important to know from a marketing perspective. You're going to want to know where these additional cases are going and for what services, which we'll get to in a moment. And so again, here's the top 10 hospitals in descending order of volume. The next report shows not the trend in terms of volume, but the trend in terms of percentage market share, which is an important distinction. So this up here is in terms of total cases for those 5 years, and this is in terms of the market share. And you can see the difference here. For example, Cedars-Sinai actually went up in terms of market share, while they went down in terms of volume. And the reason for that is the total volume went down during that period of time, which is the denominator. So if the denominator went down more than the case volume went down, then you're going to actually have an increase in market share. And I'll show you those numbers in a moment. And you can see the same for the other top 10 hospitals and their percentage market share changes as well. While overall other hospitals outside of the top 10 had a significant decline in market share. And then what is last here is a series of tables which show the total volume trend and the percent market share trend for each of these hospitals, in addition to the total number of cases for each year. So as I indicated, there was a decline in 2020 from 2019 in terms of total volume, from 29,000 to 24,000, but the decline in total cases was less than the decline in total volume. So you actually saw an increase in percent market share versus the decline in total volume. Does that make sense to everybody? Does anybody have any questions on that? I'm happy to review it. And then finally, I talked about all the hospitals outside of the top 10. If I scroll down, here's a list of all the remaining hospitals, or this is all the hospitals, but you can see here's the top 10 down here in the number of total cases during this period of time and their percent market share during this period of time. So you can see where they went. The other thing that's really cool about this, you can see there's this filters tab down here. So I can filter these reports. And by the way, this is all already printable. So if I hit the print button, these will print. They're already formatted for printing. Or if I just want to take them and paste them into a Word document or PowerPoint, I can just click on the individual reports, copy them, and paste them into a PowerPoint or a Word document. But what I was getting at in terms of the filters, if I want to see, what is the trend for people that had, let me see, payer category, I'll click Medicare. So I'll uncheck all the types of insurance, just focus on Medicare, and also had a service line of, let's say, orthopedics. So I'll come over here, do the same thing, uncheck all of them, scroll down to where orthopedics is, check on that. Now, when I go back to the report, as soon as that's done updating, so you can see it now says orthopedics for Medicare. Now this whole thing, you can see that Cedars-Sinai actually had 53% of that market. So that's higher than the overall percent market share for 2021. And here's the trend for Medicare orthopedics. So again, from a marketing perspective, you can run through all the different scenarios, combinations of service lines, payer mix, et cetera, and see what the trends are for all the hospitals that have patient discharges from Cedars-Sinai's primary service area. Any questions on this? And then finally, what I should have pointed out originally, which is also important from a marketing and strategic planning perspective. Let me go back to the SpeedTrack application. So I'll do a new share. Do the SpeedTrack application, share that. Can everybody see the SpeedTrack application now?
We got it.
All right, cool. So what I'm going to do now is I'm just going to focus on 2021. And I'm going to focus on Cedars-Sinai. And what I want to do is do a heat map, a geospatial heat map of where the concentration of these patients are within their primary service area. So I just click on this map all button down here. And that's taken all these, in this case, 10,000, almost 11,000 records. And then now I'm probably going to have to show you the heat map, huh? All right, let's see, where is that? Shoot, I didn't even see it on here. Oh, I'll have to scroll down. All right. Sorry about the delay.
It's okay because we all have these technical problems, every one of us.
Yeah, trying to find the map. Oh, here it is. Okay, share the map. So it created this map. Can you see the map now?
I also have a question that says, yes, we can.
Yeah, go ahead.
See, that Cedars-Sinai has the most orthopedics. Should they continue to market that department or do more marketing in other areas?
That's a great question. So another aspect that comes down to is the profitability of these various service lines. So as long as orthopedics continues to be a profitable service line, and a lot of times, and there's a couple other things to keep in mind. So if it's profitable for them to do orthopedics, which it probably is, that's usually a fairly profitable service line for them. And that can be driven by a couple of factors. Number one is what kind of contracts do they have with the insurers? And that's something they're always looking at, and what that mix is with the various insurers to maximize the profitability, because some insurers pay more or have a greater reimbursement than other insurance companies do. And so that's number one. And so if they have good contracts and have really good docs that can maintain the quality of the outcomes of those surgeries, they'll continue to do that. The other thing to keep in mind, and we actually have another application that provides this information, which I'm currently not sharing with CSULB. We'll probably be doing it with the graduate classes, but we can forecast into the future what the trends are going to be for their service area by age, race, ethnicity, and Medicare is principally people over 65. In fact, you can think of it as it's all people over 65. So if that particular type of insurance is profitable and the population over 65 is growing or projected to grow for the next 5 years, let's say, then yeah, it probably makes sense to bet on orthopedic surgery for that service area. Any questions on that? Does that make sense? The other constraint that hospitals are starting to have, and it's there's a lot of pressure put on particularly acute care hospitals today, but another aspect of that pressure is coming from ambulatory surgery centers. There's more and more procedures that are being done in ambulatory surgery centers today. So for example, 10 years ago, major joint replacements like hip replacements and knee replacements were done inpatient. That's because they hadn't really developed the techniques and the technology and the type of implants that were available for outpatient surgeries. And outpatient ambulatory surgery procedures are where the patient comes in the morning and they leave in the afternoon, so they don't have an overnight stay. And there's more and more procedures that are being done in an outpatient setting rather than going into the hospital. And there's a couple of reasons for that. Number one is ambulatory surgery centers are very efficient. The cost associated with performing a procedure in an ambulatory surgery setting are much less. So the insurance companies like that. And the outcomes are better. There's, there's fewer infections, and the patients typically have better outcomes when they can just come in for a day and then go home and be at home rather than staying in the hospital. There's an exception to that. People that have other comorbidities and chronic conditions, they'll still do them in the hospital because they tend to be sicker patients and are more likely to have a negative outcome. So if they're obese and have diabetes, stuff like that, chances are their procedure, even though otherwise it would qualify for an outpatient procedure, they'll be done in the hospitals. So I know all this information is like taking a drink out of a fire hose, but you'll be hearing this over and over again. This is what's happening in healthcare today. Any questions on that? Any follow-ups? Let me get back to the map. So what this is showing is by the zip codes, the breakdown of where the patients are coming from by zip codes. So you can see Cedars-Sinai is right here. You can see these zip codes. So the number one zip code is 90046, which is northeast of the hospital. And then the lowest zip code is probably 90016, and I'll show you that in a minute. But you can see the legend over here for the number of patients from each zip code, red being the highest, blue being the lowest. I can change the color scheme if I want to, just by clicking on these buttons here. And then I kind of like this one the best. And then if I scroll down, it'll give you the list of the zip codes. And the total encounters, oh, it's not showing that. Let me see if I can update this. It's not showing. I don't know why. It should be showing the zip code for each zip code and the number of encounters per 1,000 population for each zip code. We'll have to, it's a bug. I think it only has to do with the implementation for CSULB. So we'll look into that. Any questions on the map?
I have a question that goes back to something you showed us a minute ago, but I just keep thinking about it. When you showed all other hospitals, and you don't have to show it again, it's just a question. The Olympia Hospital, I think it was, had like substantially more than all others. So I'm curious to know if that's the kind of, like, you could go into that Olympia Hospital and see, what the things are that they have more of, or, why they're pulling so many more from Cedars-Sinai. Wouldn't that be some information that would be good to drill down?
You bet. And we could absolutely do that in the application. And in fact, I'll go back and do it right now. And I'll show you how we can do that really simply. I haven't shown you this yet, but so I'll unclick Cedars-Sinai.
I didn't mean to.
No. This is good. Let me share my screen. Again. Can you see it okay?
Yes, we can see it.
So I'm looking at all the hospitals now, and I'm going to unclick 2021, and I'm going to look at that trend across all hospitals. And the way I'm going to do that is we have this inpatient market trends tab here, and this will take care of that for me. It'll take a minute or several seconds to update, but what it's going to show me is the total volume by year for each hospital. It's going to show me the total volume by year for each service line by the type of payer. And if it's a managed HMO plan, it'll show me who those plans are with. And in addition to the volume, it's going to show me the change in volume between 17 and 21. There it is. The average length of stay for 2021, the case mix index, etc. And so let's scroll down here and see. Here's Olympia Medical Center. And the reason it showed them so far down on the list is you can see they took a huge dive in 2021. They only had 2019 discharges in 2029, where in 2017 they had 2252 discharges. So that's the reason they were so far down on the list. Otherwise, they would have been second on the list. In 2017, in fact, I can sort just by clicking on the column header. And you can see here they are number 2 in 2017. But the way we sort it is by the most recent year in the data. And so they fell way down here. But if I want to know what Olympia Medical Center was doing, I can click on Olympia. And I'll be able to see their payer mix trend during this period of time. I'll be able to see their service line trend, etc. And if I want to compare the service line trend for Olympia versus Cedars-Sinai, all I have to do is, so here's the service lines trend for Olympia, just like what I did with the zip codes earlier. I just right click here in this category. I copy and paste the trend of service lines for Olympia into a spreadsheet. And then right next to it, I unclick here, click on Cedars-Sinai. And I can copy and paste the trend by service line for Cedars-Sinai into the spreadsheet. And I can do the comparisons right there on the fly. I can see which ones were gaining. I can do the same thing for the type of insurance and if they're using a payer plan. So across these 4 different dimensions, I can get that information very quickly. And because they're all interactive, I can see, you know, Medicare traditional coverage seems to be the #1 type of insurance. You know, and instead of just focusing on Cedars-Sinai, I can see what that trend is across all hospitals if I want to, just by focusing on Medicare, unclicking Cedars-Sinai. Every quadrant will adjust to show that information. So the cool thing about this is if I'm in a meeting with the CEO and COO and CFO, and maybe a couple docs, service line leaders, you know, we can play around with this in real time in a meeting. And the way other systems do it, if they're not using SpeedTrack, is the CEO will ask the IT department to create a report. They'll get back to him in a few days with the report. Then the CEO will have follow-up questions. They get back to the IT department. They create the reports. And it goes on for weeks sometimes, where with SpeedTrack, they can sit down in a meeting and within an hour, really get a solid idea of what's going on to create marketing and strategic plan strategies. So that's kind of a plug for SpeedTrack.
And a good one. One of the things I love about SpeedTrack are those graphs and those pie charts, you know, because they explain so much more than, you know, having to filter out these numbers in your brain, you know.
Yeah, and we can create those. I'll show you. I mean, I'm just kind of scratching the surface here. So if I just want to focus on the recent year, and let's say I want to do a bar chart for the top 5 or 6 hospitals for 2021, I'll just pick them. And then I'll come up here to the settings menu. And there's a lot we can do, and I'll turn it into a bar chart. There's those hospitals. And again, this is still interactive. I can click on any of these things. And keep in mind, I'm looking at Medicare traditional coverage for these hospitals. If I want to focus in on a service line, let's do obstetrics, for example. Just to have fun, let me sort this. Oh, there's orthopedics. Where am I missing it? Oh, because I clicked Medicare. There's no obstetrics for Medicare because these people are over 65. But you know, we can do orthopedics instead.
One would hope.
Yeah, exactly. So you can see these things update. If I want to make it at a logarithmic scale rather than a numeric scale, and that'll make these things look bigger compared to one another. So I changed the y-axis from linear to logarithmic, and so you can see the differences that way. It kind of brings out the differences. But I can do predictive modeling. We can do all of this stuff in any combination of categories you want to. Again, this is an undergrad class, so I didn't want to get too deep into this stuff and kind of give you a high level of some things that are really informative and very useful. And frankly, once you do it a couple times, it's not hard to do. And like I said, we have the step-by-step instructions on how to do it as part of the curriculum available. So I think we're reaching the top of the hour. Are there any additional questions or comments before we sign off? Well, thank you everyone for your time. If you have any questions after the class, feel free to filter them through Linda and she'll get to me. I'd be happy to do a follow-up if you're interested in doing a deeper dive. I'm at your service. So again, thank you very much. Good luck with your studies and your future in healthcare.
Jeff, thank you so much. This has been really informative. Every time you do it, I learn something new. I just think this is the most powerful software, that I've seen. And, there's always people counting something, and this is really incredible. Y'all have done a great job.
Well, thank you very much. I really appreciate that. It's incredibly gratifying to hear that. Every time I hear it, I get goosebumps. So thank you very much. It's true. We put a lot of work into inventing this software and we're very proud of it. So I appreciate your comments.
Well, thank you again. Anybody, last opportunity, anybody have any questions, anything, comments? Okay.
Thanks again, everybody.
Bye-bye.
All
right, Jeff, we'll see you tonight at 7 o'clock.
I'll be there.
All right. Thank you.
You bet. Bye-bye.
Bye-bye. Okay. So, I know that's a lot thrown at you at once, but it gives you an idea of what's available out there. Some of you may already be in some of the other classes that use this program, but you will see it at most of the hospitals that you might be working at, even as internships. And it's really an incredible aid for so many things. Me, for one, I'd be wondering why Olympia has so many, has snatched so many of my patients away, because it was substantially more than any of the all others. And then I would wonder why they dropped so drastically when everyone else didn't. So there's a lot of things you can look at. There's a lot of, data there that is just great. So, okay. Do I have any questions? Thumbs up. How many of you found this to be interesting? Okay, super. I like to bring speakers in that enhance your education. So, okay, super. All right, it is almost 9 o'clock, so I am going to let y'all go. I will, if you like, I can open the breakout rooms if any of the groups would like to visit with each other for 15 minutes. Otherwise, y'all are free to go. So, does anybody want me to open the breakout rooms? Do y'all need to visit anybody?
Yes, please.
Okay, I'm going to open them all up then, and y'all are free. I don't have any meetings or anything, so y'all are free to stay in it. Well, at least till 9:45 or 10, if you need to or want to. Okay, so I am going to create them, and y'all can, if you need to meet, great. If you if you think you're good to go, then I will, you're free to go. Maya, you there? Oh, your speaker's not working. You might want to send me a chat if you have. Yeah, you're muted, Maya. Nancy, are you there? Nancy? Than, you there? Oh man, Maya, you have some problems. I'm telling you, you must be annoyed a good deal of the time. Do you want me to send you to your group, Maya? Can you? Let's see. All right. Maya, do you want me to your group? Okay. Van, are you there? Nancy, are you there?
Yeah.
Do you need me to send you to your group?
Let me do it. I got it.
Okay,
Thank you.
you bet. Van, are you there? Van, hello? Maya, you're back.